See any? Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa ashabihi ajma'in. A very good evening to everyone that is watching us from wherever you are, and to all of our honorable guests. Inshallah today IUM Student Union, in collaboration with Office of Deputy Rector Student Development and Community Engagement IUM, will be holding a virtual student and administration dialogue on COVID-19 information and also updates. My name is Anas Hayyan bin Ahmad Zakwan, and I will be moderating our virtual dialogue for today. And allow me to introduce our guest, our honorable guest. The first one is Associate Professor Dr. Zulkifli Hassan, the Deputy Rector Student Development and Community Engagement IUM, Dr. Siti Mashita Jamaluddin, Chief Medical Officer IUM Health and Wellness Center, Brother Amir Nazim, President of IUM Student Union, and Brother Muhammad Ziaul Haq, President of Postgraduate Student Society ICOL. So allow me to introduce what are the overview of our dialogue for today. Inshallah, today we'll be covering on the development of COVID-19 at IUM, what is happening inside IUM during CMCO, what are the policy by IUM management during the CMCO period, and what are the initiatives for the students, maybe from the university and also from the students' body. The flow of the programs will be 2 rounds of questions from me to each of the panelists, and after that we will be opening up questions from the floor. So if you guys have any questions to be redirected to any of our guests for today, do drop the questions or the comments at the comment section, and we will be reading every single questions, inshallah. So inshallah, the first round, we will be starting our first round on we will be starting with Dr. Mashita. Assalamualaikum, Doctor. As you know, we have been hit by the pandemic since last December, or since last year, and we have been hit severely on March. Then after that it eases a bit, but then we are hit by a more severe hit by the COVID-19 until the second CMCO. So maybe you can explain, or maybe you can enlighten us on COVID-19 situation inside IUM as the Chief Medical Officer, as the first person in line at IHWC.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Allow me to share you with the presentation that I have prepared, because there will be a lot of information in there. Okay, can anyone see this? All right.
Yes, Doctor.
So let's take a look the overview in the state that we are now. We are in the state of Selangor. So the statistic will be on the 7th and the 8th of December. So you will concentrate on the district of Gombak, where we are now, and we are at the county of Mukim Batu. As yesterday, we can see that we have 71 new, it's not a new cases, it's an active cases. And as of today, we have another 69 new cases. So altogether, you can see that the new cases is more than 400 altogether. Altogether, cumulative for the last 14 days is more than 400 over. So we are at the red zone. And looking at the state, and we are at the district of Gombak, you can see here is a lot of red zones around us. And we are at the Gombak area, and the district that nearest to us in the Petaling and Hulu Langat. These are all the red areas. There will be no green zone around us. The nearest that we have is actually around the KL area is orange and yellow zones. And looking at the number of cumulative cases in Selangor State, we have 17,000, would be the highest in Malaysia. And as of today, we are also the highest number of having new cases, will be 417. This is the statistic as of today. Okay, looking back from the first operation of COVID-19 in IIUM, on the first wave, we started as early as 24th of January. until the 15th of February, and it slows down. On the second wave, we started on 27th of February until July 2020. And this is the latest one, will be the third wave, where the date of commencement is following election in Sabah. That would be, we started on the 25th of September. So the wave has gone to the fourth cycle. We are currently at the fourth cycle. The first cycle on the 14th until 28th of October. The second cycle from 29 until 8th of November. The third cycle from 9th of November until 6th of December. And now it's just started since yesterday, the fourth cycle of the third wave. All right, looking at the COVID-19 positive cases, altogether, IIM have 5 campuses. We have Gombak, KL, we have Kuantan, we have Gambang, and also Pagoh. And altogether, we have 8 positive cases, so 1 in Kuantan and the rest are in Gombak. We have 7 cases. Looking back at the Kuantan, and mind you that all the positive cases are students, none are among staff. And out of the 8 cases, 5 of them are living in campus. Only 3 that living outside because they are living with the family, because the 3 of them, they are doing internship outside. So 5 of them are living in campus. All right, looking back into the positive cases inside the campus, okay, altogether we have 5 cases. The case 1 is the screening before returning to Saudi Arabia, and we have 16 close contact 1 and 86 close contact 2. Close contact 1 is a very high possibility of having positive cases. So the close contact 2 is a bit far from the COVID positive case. Case 2 is a contacted to positive case with family members returned from Sabah, in which the student has 17 close contact 1 and 123 close contact 2. And among the close contact 2, there are 29 high-risk close contact 2. And case number 3, contacted to positive case from friends outside campus in screen during visit to IHWC because the students was sick. A poor historian, and the student has 36 close contact 1, 111 close contact 2 with 17 high-risk close contact 2. And case number 4 is a contacted to positive case via roommates in Mahala, in which the student has 34 close contact 1, 135 close contact 2, which are 13 are high-risk close contact 2. And the last case we had is mid of November. This is screening before returning to Bangladesh, where the student had 8 close contact 1 and 11 close contact 2. The case number 5 is the only low impact positive case that we had. So, and looking back, how much we spent on the COVID test alone for the third wave onwards in Gombak. Altogether, we have done 348 units of RTK antibody, that will be the blood test, and worth 34,800 ringgit. And PCR is the swab test, 292 tests worth 73,000. Altogether, we have spent 117,800 ringgit. It's almost 118,000 ringgit. And the rest, we had a few tests done in the Pusat Pejabat Kesihatan Daerah Gombak, Klinik Kesihatan Kuala Lumpur, and also done in KLIA, that will be in airport. So, does density aggravate the COVID-19 pandemic? Because we are living at a very dense area. We are living at the metropolitan, where the population to be one of the most significant predictors of infection rates. Larger metropolitan area have higher infection and higher mortality rates. It's stated in the Journal of American Planning Association, large metropolitan area with a higher number of counties tightly linked together through economic, social, and community relationship are the most vulnerable to the pandemic outbreaks. They are more likely to exchange tourists and business people within themselves and with other parts, thus increasing the risk of cross-border infection. So look into this. This is one of the major factors that we have to be careful with, and with the maps that I already showed you earlier on. Okay, and some says because of the targeted sampling in Malaysia, it's contributed to the increased number of cases. It's a dense areas. For example, in Sabah, we have water villages, jails, factories, and hostel. And we are in this category, the hostels category, with the means that we are at the dense area. So where are we now? how vulnerable we are, and can we afford to have another few COVID-19 positive cases in our campus. So these are the explanation, then things that we have to think of during our dialogue today. So with that, I thank you. That will be my presentation, and I hope I can answer the question that you asked just now.
Thank you very much, Dr. Mashita. Like, the presentation was a lot of things that we didn't know before, like including the cost of swab test. And so let's move on to Dr. Zul, our Deputy Director of Student Development and Community Engagement. So Doctor, what has been taken into consideration while formulating the policy since the start of the semester and followed by the CMCO? So I mean, because like your office is the closest office that is responsible for the students' affairs, and what have been taken into consideration into making all of this SOP?
All right. Thank you very much to Anas. Okay. Thank you very much to all the panelists for this session. This is the first virtual student admin dialogues. Okay, and thank you so much to all students who are making your time to listen and to watch this dialogue. So Alhamdulillah, I think it will be a good start for us to have a series of engagement. Actually, we have already a series of engagement with students, with the student representative, including not only student union, but also postgraduate societies and international students. But as a start, I would like to record our utmost appreciation and heartfelt gratitude to our frontliners, okay, to medical doctors, to our nurses, okay, and to all frontliners from IHWC, IAM Health and Wellness Clinics, and also to Sultan Ahmad Shah Mosque, to Sultan Ahmad Shah hospitals, okay, awesomes, okay, securities and all volunteers, okay, uniform bodies and everyone for putting their life at risk to protect and to safeguard our campuses. Okay, I would like to thanks Student Union and also postgraduate societies, okay, for your support. Okay, and also Student Union provide us with the data and the survey, help us in making good decisions. Okay, and thank you so much to all students. Okay, actually, I would like to express my thanks to all students for your patience, for your understanding, and for your cooperations. Alhamdulillah, until now, we managed to maintain, okay, the status of our campus. Unlike certain other universities like UTHM, they have already closed down for a week. Okay, UTHM because of the COVID-19 cases and also other institutions. So I would like to start with to answer the question by Anas, looking at how do we handle the pandemic in IIUMs. So I would like to mention and to reiterate here is that I'm not the one who making decisions. It is actually a collective decision. Okay, where in early 2020 we set up and we established Sejahtera Council, and Sejahtera Council chaired by Tan Sri Rector, Tan Sri Honorable Rector, and consists of all representatives from KCD-IUM, from Kuliah, from department, divisions, institute, offices, including student unions and Mahalla. Okay, and we also have a representative from hospital, from Sultan Ahmad Shah Medical Hospital in Kuantan. Not only Gombak campuses, but also Kuantan, Pagu, and Gambang campuses have representatives. So it's a collective decision, and we have no intention at all to make your life difficult. Okay, all of our decision is for the sake of the interest and also for the sake of safeguarding and protecting our campus. Okay, so in order to speed up and to operationalize, okay, the decision made by the Sejahtera Council, we set up another small or executors. We call it operation rooms members. So this operation room, we have almost daily meeting, okay, and also represented by KCD-IUM, okay, but more on operations, how that we operationalize and execute the decision made by the Sejahtera Council. So if you want to make very important decision, for example, the decision that we released today is good news for the students. Okay, we have to refer to the Sejahtera Council and chat by Tan Sri Rector. So then we make decisions. So we execute the decisions through the operation room meetings. Okay, so how do we make our decision, and how do we handle all the questions or the issues raised by the students? Okay, first we issue the guidelines and SOP. Okay, from time to time, based on the whole situation of the campuses, not only in Gombak, but also in Gambang, in Pago, in Kuantan, also in KL campuses. And this is very important to strike the balance, okay, between the rights and interests of the students and also to protect and safeguard the campus. Okay, we receive many concerns, many questions and inquiries from the students. Some students want to go out. Some students even appeal to us to lock down the campus, even to restrict the Grab food to come, because they are really concerned. But we need to strike the balance between these two extremes or whatever. Okay, so and secondly, we refer the MKN guidelines by the MKNs, by the Ministry of Health, by Ministry of Higher Education, also by the relevant authorities. And not only that, even though we have the general guidelines, but we need to consider the specific situation in IIUM. So that's why we also consider the overall situation of the campus, such as the number of positive cases. Okay, number of positive cases. Actually, we want to allow students to go out. Okay, but when we wait until the campus become green again in Gombak, for example, then we found out that another positive case happened. So that's why, okay, you can see that. But after the campus, particularly Gombak campus, becomes green again, so we finally, the Sejahtera Council agreed, okay, to allow the students to go out starting from tomorrow, inshallah. Okay, and also we are also very concerned about the cost, okay, that the university need to incur due to the positive cases. 170,000, not the total cost actually. It's only for medical, okay, for the swab test and so on. But if you calculate and total it up with the food and also with the manpower, with the hours and so on, I think it's more than 200K. Okay, the cost. This money can, if we can save it, we can give it to the students on to have a student development program and so on. Okay, the next thing is what the challenges. Okay, even though we want to allow the students to go out or allow the students to relax a certain SOP and rules, okay, we also face the challenges. Okay, for example, intruders of our campus. Okay, intruders. I think almost every day, okay, there are intruders and also squatters, okay, in our campus. And not only that, vandalism, and what is more important as well, fake news. Okay, and fake news and hatred and also seditious messages, okay, on social medias and so on and so forth. So these are among the reasons or the justification or the rationale how that we make our decisions. And alhamdulillah, okay, so far, okay, with the support of all students, with the support of all staff and IIUM community, we alhamdulillah we managed to maintain, okay, the status of our campus become green again. And with the recent announcement, okay, we have reviewed the existing SOP, and inshallah we have review from time to time other SOPs, even guidelines, okay, based on the overall situation of the campus. So today we have already released the guidelines for the student to go out as a matter of necessities. So and even when we have a discussion with the international students and student union and PGS societies, they say that they want only a few days. We can start with a few days, okay, but we give the whole week, okay, from Monday to Sunday, okay, for the student to go out from 9 to 5. So this is the test. So if let's say that we can maintain the greenness or the status of the campus, I believe that we can relax many SOPs. And inshallah, we will open swimming pool, inshallah very soon, and then student can have a back to normal life. Thank you.
Thank you very much for the insightful information on your behalf, Dr. Zul. Moving on to Brother Amir, our president of IUM Student Union. So Brother Amir, maybe you can explain what has been the role of IUM Student Union? What role has IUMSU played in the policy making process, just like Dr. Zul has mentioned, for example, like in the Sejahtera Center, and also what has been the suggestion by the IUMS Student Union in terms of, for example, ERTL, or for example like basic necessities like internet data for all of our students.
Alright, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alright, with regards to students' welfare, ever since before the CMCO has been announced, we have moved closely with Office of Deputy Director Student Development Community Engagement with regards to student affairs in IUM, basically on the returning students, on new intake students. So we have been having discussions with Office of Deputy Director since before the CMCO and even before the semester starts. So one of our main initiative is that we officialize and initiate IUM Student Union Operation Center. As what been mentioned by Dr. Zul just now, we have IUM Operation Center. This basically covers the whole university, not only Gombak, but also issues from Kuantan, Pago, and also KL campus. So IUM Student Union Operation Center focusing on on Gombak campus only. So under IUM Operation Center, we have several other initiatives such as the buying petrol for students. So basically, there's restrictions of movement for students where students cannot go out. So we provide a service buying petrol for students. Those they just need to provide bottles and some charges. So around 2 ringgit charge. But after this, a student can go out. So I think they can go and go to the petrol stations by themselves after this. But then, that's one of our initiative. So other than that, we also still in process for data plan. So currently we are waiting for the name list to be filtered by Endowment Fund, IUM Endowment Fund. So basically they have strict procedures to be done to filter out the names to make sure that only those who are eligible to get the assistance will get the assistance lah. So basically, IUM Endowment Fund agreed to assist to give financial assistance, a free data plan for B40 students and all those needy students for 5 months. Okay, so we also collaborate with Celcom for this initiative where we discuss, and Alhamdulillah we get better result for this data plan. We get unlimited data for standard streaming apps and also YouTube. But then, currently we are still in progress. We're still waiting for the final list, those who students are eligible for the financial assistance by the Endowment Fund. Next, we are also the members of IUM Operation Center. We joined the meeting almost every day. Sometimes me myself joining the meeting, and sometimes we also have Brother Amin Mubarak joining the meeting. We have also Brother Asnawi and Sister Idayu, Brother Arif, and all the members of Student Union involved in the discussion as well. So other than that, involved in discussions and also decision making. So basically all the guidelines that been released by IUM have us, the Student Union, involved in the discussion and in deciding on the how the guideline should be. Okay, so other than that, we're also collecting data, like you guys might already know as well, like urgent survey for COVID, survey for ERTL. So all this, based on all this survey, we collect all this data, and also we are not presenting only raw data. We also proposing suggestions and solutions for the university to take into considerations. Okay, so these several findings we also presented in IIUM Sejahtera Council. So like Dr. Zul mentioned, IIUM Sejahtera Council is basically IIUM's emergency response teams of IIUM, right? And other than that, we're also assisting in distributing necessities to the students in campus, where we receive assistance from Team Selangor, PKPIM, and recently from UMNO Siswa as well. So there's many basic necessity assistance. And not to forget, we also receive financial assistance from the Deputy Minister of Youth and Sports, which is YB Wan Ahmad Faisal, around 5,000 ringgit. And inshallah, in the future, all this financial assistance and also donation drive that we receive from the public will be given to the students in maybe in form of one-off financial assistance or maybe in form of goods. So for that, we are still in planning on how we can assist the students more. Is that good to give? Is it like the needs of the students basically on monetary or maybe in goods? So we're still in discussion on how we can distribute that finance on that donations by the public, right? I think that's all from me on with regards to the policy making process.
Thank you very much, Brother Amir, our President. I think we can move on to Brother Zia, the PGSS President for ICOL. As an undergraduate student, I don't think I know what are the commitments that are different from UG and PG. So maybe you can share what are the commitments of postgraduate students that may be different, and how do you cope with the current situation of the pandemic where movements are restricted and whatnot, and what have been the initiative provided and done by PGSS?
Bismillahirrahmanirrahim. I would like to express my gratitude to Brother Anas and our beloved panelists. Honestly speaking, this has been a very challenging year, for all the students and IM community. And unlike undergraduate students, that we have, on campus, that they have access to the online classes, our postgraduate students, they have been the most affected because, vast majority of our students, they are PhD students, that they have no classes, and even, our master students, they have to do mixed mode. So they need, to attend, the library in order, and do the interviews in order to complete, their thesis successfully. And unfortunately, this we have been, with this test, from Allah Subhanahu wa Taala. So we have been noticing that, that how this impacted, our postgraduate students. So from very beginning of, this pandemic, we have been in contact, with the Office of Deputy Director of Student Affairs, Dr. Zulkifli Hassan, and he has been very kind and very supportive, and listening to our grievances, concerns, and, the issues, that the students, they have been facing. What has been done, by the PGSS, that so far, and PGSS Central, we have two PGSS, one is, for the whole university, so we call that, Postgraduate Student Society. And we have also PG-based societies, like the one, that I'm chairing with the team. So we have been conveying the concerns of the students, to the respective, officers, and then the offices, that we have been dealing with. And the most of the concerns, from the students, that we had, they were really asking, for the opening of, the library, because, they have been, heavily depending on the datas and then the books and the references, and the thesis manuals, that we have in the library. So, taking into account, that we have been under lockdown, for the past 5 months. So, few of these months, they had no access, to the library. So we can say, safely, we have been, the most affected, students of, this university. However, that Alhamdulillah, with the initiatives, that have been taken, by Sejahtera Council and our cases, have been conveyed, by Dr. Zul. So Alhamdulillah, these problems have been solved. Our postgraduate students, they had, requests of, going outside, not, for the personal matters, but, most of, these requests have been, due to data collections and, interviews and those kind of things. That was, that, really challenging, and we had to convey, this, issues, to their respective authorities. But I have to say that, among all those officers, that we have dealt with, with their team, I have to say that, Dr. Zul, was the most receptive office and have been, helping us, to settle the issues, that we have. Since we have received that information that the students have been doing, they are able to go outside of the campus from tomorrow onwards. We have been sharing to our postgraduate students to avoid the red zones and any areas that might not be safe enough for the students to go. So we have the map of these red zones we have shared, and we have been in touch consistently with the students and in the same time with the administration from very beginning until now. So these are the challenges and the problems that we have been dealing with. I think from the postgraduate perspective, not much of challenges of us going outside was the concern about the interruptions that had been occurred to them was the thing that have been concerning us from very beginning until now. But so far, alhamdulillah, with the initiatives that have been taken by the university and the Secretary Council, I think we can overcome this one. But they have been compensated as well, with the Mahalla fees, those things that I think have been raised by student union. We have to appreciate their efforts on that one. So I think that had mitigated the risk, the concern, and the problems that they've been facing. So we are ready, to assist the management in any ways, it's possible, at least, that to solve the problems of the students, and then any issues, that they have been facing, I think, from time to time. Thank you very much. That's all from me.
Thank you very much, Brother Zia. That is the end of our first round. We have one more round of questions from me to each of the panelists. So in the meanwhile, all of our viewers at ORDSDCE Facebook page can drop the questions at the comment section. So we will go back to Dr. Mashita. As we all know, we have seen before in the presentation that there have been 4 cases inside IUM Gombak. And for various reasons which the students may not know, but we have been enlightened before in the presentation just now. After this, students will be allowed to go out with the recent SOP, so the movement in and out is basically lifted and we are free to go and as long as we follow the SOP. So but if there is a newly found cases inside IUM after this, what will be the measures that IHWC will take, and what would be the suggestion from doctor to the students that will be going in and out of the university?
Okay, talking about the measures that we are taking is the same like previously, that we have to, every influx of students with a certain race, a certain announcement, they have to come to the clinic for declaration. Declaration is very important. And why? Because this is where we will detect the early exposure, the early indication, the early risk, which will be probably having the contact with the COVID-19. So in the declaration, even sometimes we found out that the community, the IIM committee, not only for the staff, but only for students, they are not declaring honestly. So this is also a risk to the healthcare workers in the clinic. All right. Secondly, the measures, this is screening processes. And later on, if there is a suspect cases, and this is where the challenge is, where we have to pull up all our strengths in terms of time, in terms of our numbers of staff to do the contact tracing. As all you know, that all this while, all the contact tracing outside is being done by the Ministry of Health. But because of the efficacy, the efficiency that we have done, we are being given the trust from the Pejabat Kesihatan Daerah Gombak to do our own contact tracing and manage our own cases. So this is why we are able to capture the case and the contact, the close contact very quickly, and we are able to disclose which one is negative, which one is positive, because we got a very help. We have help from the hospital Kuantan. If we are to wait from the help from the assistance from the Pejabat Kesihatan Daerah Gombak, it will take 5 days to 1 week for you to know whether your friends is positive or your friends is negative. So this is the challenge. But as of now, because of the increasing numbers in Kuantan, in Kuala Lumpur, we have been given advice by the hospital UAE that we have to be cautious with the numbers of investigation because the kit is reducing in numbers. So if there is any new case coming in inside the campus, then we have to ask from assistant in Ministry of Health, in which then we have to bear in mind that the time taken will be longer than the previous one. Previous one, 1 or 2 days, you already know the result. But if Ministry of Health, you have to wait for 5 days to 1 week. Even as of now, as of today, we have 5 of the students coming back from Sabah. They have to go for second swab in Pejabat Kesihatan Daerah. They have to continue their quarantine time more than 14 days. They have to be quarantined for, I think, about 22 days. Then they are being released from the quarantine. So I think if we have one more with a high impact because of the not following the SOP, or you are unfortunate enough to have been contacted with the positive cases outside, then you have to bear in mind it will gonna give a huge impact inside our campus. All right, then as you know that if one positive cases, high impact will cost you 40K to clear off. All right.
Thank you very much, Doctor. So everyone, please do follow the SOP.
Yes.
Because it will cost a lot, not only in terms of money, but also in terms of our freedom to go out of the campus. So talking about the SOP, maybe Dr. Zul, you can like share a glimpse of the discussions inside the Sejahtera Committee or inside the operation room, because as we all know, the students that are stuck inside the campus have been stuck for more than 2 months without going out of the university.
Yep.
But we are looking outside of IUM in Selangor area, though it is a CMCO, but people are living freely. They can go to the mall, they can go everywhere, like it's a normal time. So was it a hard decision to make when the Sejahtera Committee wanted to allow the students movement like to go out? And was it like, is there any like reasons for you to allow people going out? Maybe because of the uproars on social media, or maybe other reasons.
Okay, thank you, Brother Anas. I think the first thing that we must prioritize at whatever cost is the life, okay, of our students, of a life of staff of NIM community. So we cannot compromise it. That is the first one. Okay, but before I answer that questions, I just want to extend, okay, and also to share the university initiative to help the students. Okay, not only the student union. Okay, the student union. So the situation, you have to understand the whole situation of the financial health of the universities. Okay, despite millions of ringgit, okay, loss of income, okay, and also the budget cut, okay, we still entertain and accommodate the request by the students to have a student reductions or discounted fees for hostels and other fees. Yeah. So we are now living in the deficit. So this is the first one, the situation that we need to realize. Okay, and despite all of that, okay, we managed to help or to assist, to provide many financial assistance to the students. Okay, we I think STAT and also other officers can also verify this. I think we spend more than $1 million, okay, helping and assisting the students, providing free food, financial assistance, one-off financial assistance, okay, pocket money, zakat. Okay, we also provided free laptops. Okay, free laptop. We give the laptops, not give the money or the loan. We give the free laptops. Okay, I think more than 200 laptops to students. We even posted and shipped the laptops to students' home. Okay, to that extent. Okay, but I'm not sure whether the students know about this. Okay, and also we allocated for 1,000 free data plan for students, 1,000. Okay, and also other assistance. I think I do not want to share with all of you, but I think a lot of initiative by the universities to the students. So we really care our students, but we need, as I mentioned earlier, we need to balance it with the right of the students to do something, but at the same time to safeguard, okay, the safety, okay, the security of our campus. So talking about the SOP and the guidelines, okay, so far we have issued several and many guidelines, but the guidelines is a living document. Okay, it will be reviewed from time to time, and it's not that easy for you to review the guidelines because, okay, number one, okay, the situation changed dramatically, and also the instructions by the relevant authorities, okay, the Ministry of Higher Education, the Ministry of Health, MKN, National Security Councils, the relevant authorities, and also taking into consideration the overall situation in the campus. Okay, so it's not that easy, but I think our team, our Sejahtera Council members and our operation room members, okay, managed to make decision. Okay, and the decision so far, okay, even though if you cannot see it, but you can see the status of our campus. So we still maintain our campus, unlike other institutions. For example, some public universities have to close down their campus for a week. Okay, and also they experience other difficulties. But so far, in Gombak campus, Alhamdulillah, in Gambak, in Kuantan, that's why we are among one of the institutions been given by the Ministry of Health to handle our campus without interference by the Ministry of Health, by KKM. All right. So they give the autonomy, they give us the authority to handle our the cases, and also to monitor and the cases in our campus. So it's a recognition by the Ministry of Health, and even we spend our own expenses, okay, to fund or to pay for the swab test costs and so on. Okay, so I would like to take this opportunity to mention here to all my beloved students. Okay, even though this is pertaining to the guideline for students going out for campus, okay, tomorrow, from campus tomorrow, but I would like to take this opportunity, if Dr. Siti, okay, does not take the opportunity to remind, or not to warn, but to remind not only the students but also to staff as well. So for your information, we collected and compile every day your concerns, your issues, okay, brought by, shared by student union, as well as from Zia, from Brother Zia and the team from PJS International Students. So we discuss daily, okay, with the operation room members, okay. So so I would like to reiterate and highlight here is that, okay, guidelines for students going out from campus. Anas, give me just another 3 minutes, okay. Okay, these guidelines, okay, to allow the student to go out from the campus, okay, number one, okay, to remind everyone that it is a matter of necessity. Okay, so if possible, stay put or stay on campus. Okay, but if you need to go out, okay, you can go out, but make sure that, okay, you go out as a matter of necessity. Okay, and number two, okay, please, I would like to appeal to all of you not to go to the designated red zone areas. Okay, red zone areas, such as you can go to the link, okay, and you can refer the updates. For example, in Selangor, okay, in Kuala Lumpur, Kampung Baru, Pandan, Sentul, okay, in Selangor, Klang, Sepang, okay, please do not go to these designated red zone areas. Okay, you can go somewhere else. Okay, please. Okay, because we want to minimize the risk. Okay, number three. Okay, please follow the CMCO regulations. Wear face mask. physical distancing, okay, and hygiene, please. Okay, number 4, okay, please install and activate your MySejahtera. This will be very, very beneficial, okay, very, very beneficial for contact tracing, okay, for contact tracing, if anything happened to you, okay, and please scan I attend QR code, okay. Number 5, okay, this I do not want to warn you or to give you just like okay, outing this guidelines or this nikmat or okay, this privileges for you to go out, okay, maybe stop or maybe revoke if there is positive cases in the campus. So we have to do that. Why? Because we need to do the contact tracing. I cannot imagine if our campus experience the same thing with UTHM, experience the same thing with Top Glove. Unlike other public universities, we have the largest numbers of students on campus. Okay, in Gombak, we have more than 7,000 students. In Kuantan, we have more than 700 students. In Pago, we have more than 100 students. Almost altogether about 9,000 students. So we do not want to risk our campus. We do not want to risk even a single life of our community. So please I would like to appeal, please do that. And finally, okay, I would like to appeal to all of my beloved students. Okay, please, no fake news. Okay, please, no fake news. Right? Because we receive numerous fake news, okay, which try to give a different dimension and try to create hatred, okay, to amongst the IAM community. So in short, I would like to summarize, okay, my answer to Anas is that, okay, in making decision is not that easy. It's a difficult decision, but our decision will I will make sure that our decision will be based on the utmost, okay, the safety and the security of the campus, and also for the interest of all IAM communities, especially our students. So please keep praying and make dua to Allah subhanahu wa ta'ala that Allah will continue to safeguard and protect our campus, and please stay safe and take care of your health. Thank you.
Ameen, inshallah. Thank you very much, Doctor. I hope all of our viewers and all of our friends in IUM will follow all of the SOP and all of the reminder by Dr. Zul just now. So let's move on to Brother Amir. In your observation, what is your view or opinion on the students? Have they abided by the SOP given by the university? And I also know that there is a 24 hours hotline center in IUM and in IUMSU. So what have been like the struggles of our students?
Right. So this is quite some tough questions for me, which is with regards to the students abiding the SOP or not. So first of all, throughout this CMCO, IAM Student Union has been collaborated with MRCC, Mahalah Representative Coordination Council, the previous tenure, and also the new lineup recently been appointed, and also Kuliah di Society, and recently with PJSS through Brother Zia. So we have collaborated with these bodies and also other bodies to help in to make sure that students' welfare, student well-being in campus is always taking in being our priority, and also students following the SOP. Based on my observations, at the beginning of the CMCO, most of the students tend to follow the SOP that made by the universities itself. So yeah, most of the students following the SOP closely, wearing face masks, scanning the QR code, scanning the temperature wherever they go. But recently, I can say that more and more students tend to not following the SOP. For example, we can see at the cafe of every mahallah, and every cafe actually. And it's also, and these things is not specific for only students, also some of the staff as well, that in the cafe that did not sit alternate seating and following the SOP in the cafe. And yeah, that's one of the things. And also playing sports. So previously, based on the previous guideline, for the first guideline saying that only jogging is allowed, but then there's still most of the students and maybe some of the staff as well playing group sports. So, but then in time, some of the students then start to follow the SOP when the case getting serious in IIUM. For example, we like previously we have cases in IIUM, so they tend to slowly follow the SOP that been made by the university. But we also understand the struggle of the students. For example, the mental health and academic issues. So these students tend to go like playing sports to release their tension. So these are the things that we take into considerations, and that's why there's no action taken up until now for those students who breach the rules and and not following the SOP. So, but then we're going to allowing the students to go out. So I hope that all the students and also staff as well to follow strictly the SOP, because we doesn't know who going outside, and also when they return, will they have the virus? Na'uzubillah min zalik. But then we want to reduce the risk. We know that we cannot avoid the risk at all. But then we can reduce the risk. So this SOP are one of the method of reducing the risk. So, and we understand that not all students can stay still doing nothing, but then still maintaining their mental health condition. Some of the students, by staying still, their mental health conditions become worse. So these are some of the considerations that the universities have been taken to make sure that the mental health of the students are also taken care of. And also under the CCSC as well, they have a team that handle these mental health issues. And so based on my observations, we can, if I have to give a percentage, I think I can give it 50-50, because that's, we can say 50% of the KIIUM community following the SOP, and some of them are also not following the SOP that closely. But then hopefully in the future, with the recent development of the CMCO of Malaysia, and also the recent development in the IIUM guideline itself, hopefully students are more to follow the SOP that we, the university, have decided to allow the students to go out for any necessities from 9 a.m. to 5 p.m. every single day. So hopefully students are more abide to the rules and regulations, and also for SOP. And also with regards to financial issues, we received many reports from the students that the students have financial issues. They want to do part-time. They want to get a financial assistance under our treasurer office, but the Yusuf also received several financial assistance requests, and he have given for some of the students that really in needs of financial assistance. And hopefully in the future we can assist more students with those donations donated by the public. And also with regards to academic issues, for example, they have internet issues, like timing issues, and as well as during the semester break, the students also have like mid-semester quizzes. So these are the issues that we brought into the discussions of Operation Center, Operation Room IIUM, to take into considerations and assist the students the best that we can. So that's all.
Thank you very much, Brother Amir. I think we can move on to Brother Zia. You have mentioned in the first round that the PG students, they wanted to go out because not for fun, but it's actually for research and for field study, because you need to go out and have movements. So based on the SOP that was released this afternoon, what is your response and your opinion on the improvements that maybe could be made inside the SOP? Because as we know, SOP is a living document, and it can be changed along the time.
Thank you very much for the Anas. I think there has been comprehensive issues have been covered by Dr. Bo and our panelists. So I think the no matter how much that the SOP is perfect, but at the end of the day it comes to us, that how we are gonna follow it and how we are gonna adhere it, by our hearts, But by looking at the SOP that we had in place, it's more or less like the one that we had it in the previous opening of university in June. It's more or less the same, but inshallah, hopefully, that if the students, our students, can adhere and follow the SOP, and ensuring that they don't go to any red zones, and make sure that all these things that they are going to take place from tomorrow onwards, and only for the matter of necessities. Inshallah, with the help of Allah subhanahu wa ta'ala, is going to be safe. That we don't have any positive cases on campus, because our university have been making very tough decisions and hard decisions, that have impacted the so many things, that they have to come up with these decisions, that as Dr. Zul mentioned, that we are living on the deficit. So these are very difficult decisions, in order to ensure that our safety is being taking place in the best manner. I have to say that that the university has done a fantastic and wonderful job, because we are the only green zone in this area. So that shows that how much our administration is caring for the safety of the students, the safety of the campus, and overall the safety of the whole vicinity that we are living on. However, as it comes again back to us, that how we are going to behave, how we are going to take these measurements and move forward. So I think we have a very beautiful slogan that has been going on among in Malaysia, that kita jaga kita, that we are taking care of ourselves. I think I hope that they did the proper translation. So it comes back to us, that how we are going to portray and how we are going to carry out ourselves, inshallah. But I pray to Allah subhanahu wa ta'ala that we adhere to the SOPs, we make sure that we follow it, we make sure that inshallah that any all things is going to be from now on, from onwards, until that vaccination comes into Malaysia, that should be for the matter of necessity.
Thank you very much, Brother Zia. So that would be the end of our rounds for our second round, and inshallah right now we will be attending questions from Facebook, where people I think have been eager to ask questions to our guest, and we will attend inshallah most of the questions because we still have time. So the first question is from Students Democratic Alliance IUM to Dr. Siti Mashita. Is the current IHWC medical supply sufficient if any students are infected with COVID-19 after this?
Okay, Alhamdulillah. As of now, our medical supply is sufficient for at least for the 3 campuses with clinics and the hospital, which is in Gambang, Kuantan, and also in Gombak. It's just that for your information, for a positive case, it's not being handled by our clinic, but then it will be sent off to Ministry of Health a medical facility, meaning that if there is positive case, that positive case will be transferred to Hospital Sungai Buloh if we are talking about Gombak. But then in terms of the close contact will be managed by us, and in future that if the numbers will be in a huge number, then we have to send over for management for Ministry of Health in terms of close contact one. But if you are talking about the medical supply, inshallah we have enough.
Alhamdulillah, even though we have enough, please follow the SOP. We don't want another case inside IUM, guys. Yeah.
Yes. We don't take things for granted. We don't take things for granted.
Okay. Next questions from Muhammad Faris Ikmal. Any chance IUM Mosque will open again since this CMCO duration? Please consider at least for Solat Jahar. Maybe Dr. Zul, if you have the answer.
All right. Thank you, Brother Muhammad Faris. I think I know Brother Muhammad Faris, a very good individuals, love to go for Salat Jama'ah, inshallah. But just to understand the framework of the legal system of our countries, the state of Selangor. So actually we want to open the mosque as soon as possible, but still we are still abiding with the decree by the Sultan. So the Sultan has already issued instructions or circular to all the mosques in Selangor. So until now, we do not receive any a new circular or new perkeliling from Majlis Agama Islam Selangor. So for your information, we must follow any instructions or any information from the Majlis Agama Islam Selangor. Why? Because our mosque is under the territory of State of Selangor. Okay, but make dua, inshallah. I think we have tried and we have already extended the appeal or to Majlis Agama Islam Selangor for us to reopen our mosque, and inshallah after that will bring more rahmah inshallah back to IIUM. Thank you.
Amin, insyaAllah. Rahmatul alamin. Next question, Muhammad Nur Khazim. What is the rationale for not giving the students to overnight? Hashtag just wondering. Maybe Dr. Zul, if you can answer.
Okay, thank you so much. This, I think the ideal one will be Dr. Siti Masita, but I will give my answer and our discussion, with the members. Okay, we want to give all students, we want to allow all students to stay overnight. Okay, but let us, allow you to go for outing first, slowly. And then, inshallah, we will allow you to stay overnight. But now it doesn't mean that we do not allow you to go or stay overnight, but you need to refer to the principal, and justify with the principal, and principal may give you the permission, approval for you to go to stay overnight. But at this point of time, let us start with this student to go out first, from the campus, and then we will slowly relax, other SOPs, other guidelines, inshallah. Thank you.
Maybe Dr. Mashita, if you want to add to the answers by Dr. Zul.
All right. To add on to the answer from Dr. Zul, actually, as of now, why we are not encouraging overnight, this is to reduce the exposure. We already know that in campus is green, and then we allow you to go out. That will be increasing the exposure. When you go to the family, the exposure will be even more. So, to be careful with, and we are not. The target of being in the campus is actually to study as much as possible. We want to reduce the exposure, and you can focus until the final exam, which is very near. And then later on, you can go back and see and meet the family.
Thank you very much,
Alright.
Dr. Mashita. So, next question from Hadijah Samdin. May I know why the SOP does not stick to the old curfew? Why 9 a.m. to 5 p.m. only? Yes, maybe Dr. Zul, we can start.
Okay, the old curfew, you can see that the numbers of positive cases is not that today. Number one, and also the areas, the surrounding areas of our campus, is still red. Even Gombak is still red zone. So why it doesn't stick to the old curfew 9 to 11? So in fact, our discussion with the PJS, Postgraduate Societies, with Brother Zia and the team with International Student Union, I think we want to start with only 3 days, 9 to 5. But I think after the discussion with the Sejahtera Council members, have agreed, to allow you to go out every day, meaning that from Monday to Sunday. So let us start with this 9 to 5 p.m. first, and then as a matter of necessity, it means that, you will, I think, sufficient time for you to use 9 to 5 to buy or to purchase or to do whatever that you want as a matter of necessities. But in case that if you have an appointment with the hospital, for example, with the clinics, I think we will allow it, no problems, But for example, I give you an example, even though we do not allow students to return to campus, but we receive Okay, we receive many students out of the blue. Okay, sometimes international students from Afghanistan, okay, out of the blue, okay, and then appeared on the main gate at the main gate, and then we accommodate and we entertain them. We never do not entertain any request from the students. So that's why we accommodated them, and then we brought them to Mahalla, and then inshallah we will try to entertain the requests of our students. So meaning that my initial or my easy answer is that okay, 9 to 5 p.m. will be sufficient, okay, for us to use this ample time as a matter of necessity. Thank you. Perhaps Dr. Siti want to justify, rationalize further?
Yes, Doctor.
Actually, it's the same reason that Dr. Zos stated. Because the earlier request is because of to handle matter of necessity. So I think even 9 to 5, the offices is closed at 5. So I mean, this is if you have the official or you have the appointment in the hospital. So I think it's fair enough 9 to 5. But if we see the cases, I mean, we can stick with the green status of the campus. Inshallah, we may consider it later on. We start first with the 9 to 5.
Thank you, Doctor. Next question by Ahmad Iqbal Rohaizan. Are the students from home allowed to return to campus? Some of us have been waiting to cross the border, and since interstate travel is now allowed, we wish to return as soon as possible. Thank you very much. Perhaps Dr. Siti Mashita can start first.
Okay, if we are following the SOP from MKN, yes, you can cross the border. But then you have to remember when you get back, you go into a population with a high density. So meaning that if you are carry the risk from the traveling, then you are spreading the risk to the more people in your place. So these are the things that we have to take care of. If there is positive cases, final exam is very near. Okay, if there is positive cases, you're gonna need 2 weeks to clear them off. If there is a few numbers, if you have a lot of numbers, what's gonna happen for your exam? So focus on the exam first. I mean, it's very near, just a few weeks more. And then after that, you can go back to the family, inshallah. By that time, the SOP in the level of the National Security Council will be more relaxing than, I mean, we may consider from time to time, inshallah. Okay?
Okay, the current status of the student to return to campus, okay, by referring to the decision or to the circular by the Ministry of Higher Education, only students falls under several categories can return to campus. That needs labs and studios, okay, postgraduate students, research-based postgraduate students, including students that do not have a conducive environment, okay, at home. They can return to campus. But we are now doing that, okay. The kuliah need to approve, okay, the request by the students. So the kuliah will filter and will consider. So the kuliah will inform the operations room, the security, okay, and it will inform the Mahalla, will inform also to IHWC, okay, the list of name of the student that falls under that categories, okay. So this will be the recent status, the recent position about the student to return to campus. But we are also thinking about allowing the students to return to campus for clearance and for other matters. But let us allow the students that falls under that categories first, and then let us have a look whether we can relax and we can allow more students to return. Okay, bear in mind, okay, our campus now is more than 7,000 in Gombak, okay, and the risk will be much more higher if more students to return to campus. But okay, I believe that with everyone, okay, follow and observe the SOPs, inshallah, we will manage to maintain the greenness of our campus. Thank you.
Dr. Zul, can I add on to the information that to that.
Yeah.
Actually, recently, as you know, that we received students returning for the what they call face-to-face class for Kuliah of Education, Engineering, and also KAED. Among them, we received more than 250. And as of today, we want to, it's the third groups that we want to release from the isolation, in which when we do the COVID test, one is positive today, in which we have to hold the, what they call the discharge today, just to clarify, just make sure that the PCR that we do urgently in KPJ Ampang Puteri is negative. So this is what we mean, that we have to screen stage by stage just to make sure that people inside the campus is remaining green. So we don't accept everybody. That is basically we return back to the concept of necessity. The environment is not good at home. We accept you to get in, but we do screen one by one, inshallah.
Inshallah. So next question is from Brother Rafiq Shahmi. A question for IUM Student Union. Can we know the next initiative IUM SU will be working for the students?
All right, Bismillahirrahmanirrahim. So basically, our next initiative, first of all, is that, like I've just mentioned just now, we tried our best to fully utilize the donations that we received from the public. So in terms of one-off financial assistance, or maybe in terms of goods. So that's one of it. So other than that, we're also looking forward in assisting any students in IIUM still what we did before, so we still continue on doing that. Our operation room will still be operating 24/7, and we have our own hotline number and also WhatsApp number, IUM Student Union official WhatsApp number. So we still continue on doing that as well. And other than that, maybe for example, any emergency cases, we also have our own like welfare car. So we have our brother Asnawi, the one in charge of welfare car. So any issues, any problems that you have, for example, like emergency cases at night and you doesn't have any transport, so you can also request for assistance on that as well. And we'll try our best to do anything that is possible and anything that we can to assist the students. And one other project that we are looking forward to do currently is that we are trying and planning on have collaboration with a few other companies such as Touch 'n Go and so on. For example, for Touch 'n Go, we are planning to have like top-up stations in IIUM so that it will be easy for the students, because currently after this, if the Rapid KL can be operating fully, basically you need to use Touch 'n Go, no more cash, no more using cash. So that's why I think it is a good way of helping the students, because sometimes like you doesn't have enough balance in the cards, but then you still need to use the card to go outside. So this is one of the long-term project that we are planning to do, inshallah.
Thank you, Brother Nazim. From Brother Rafiq Shami again. For PGSS, do you have any contact number for PG students that they can contact regarding their matters? Thank you.
Yeah, thank you very much, Brother Anas. I think we have our Facebook page is active. That they can add us PGSS ACOL. Also, they can email to us to pgss@iim.edu.my. So to that also, we are very active in the WhatsApp groups for the PG students in ACOL, Masters and PhD, that we have been contacting with them, sharing the surveys, getting the concerns, but also they can meet us in the Student Activity Center in ACOL. We also our representatives are there from 9 until 5 p.m. on daily basis. So any matters concerns that they have, they can directly talk to us. Also, we have the PGSS Center. Also, they can contact. But for us, we are in the Student Activity Center located in Ahmed Ibrahim Kuliafla. Thank you very much.
Thank you very much. Next question from Brother Muhammad Hafiz. Is it allowed for students from outside campus to reside in campus for those who still have things in their mahalla? Maybe Dr. Zul can answer the question.
Okay, the students who have still belongings, of their all of their belongings still inside the mahalla. Okay, they still at this point of time, okay, this current positions, only the student that falls under the categories, okay, that needs do not have the conducive environment can return to campus. But if let's say that Brother Muhammad Hafiz, if you want to collect your belonging or you want to stay on campus, okay, please go to your kuliah, okay, and then apply and make your request, and the kuliah will decide. Okay, so the kuliah, so we give the authorities to the kuliah to decide. So because the kuliah will know the needs and the situation of the students. Yeah? Thank you.
Thank you very much, Dr. Zul. So, next question. From Brother Akhwan, can the management reconsider changing back the cafeteria and shops operation hour back to the pre-MCO schedule? Dr. Zul, maybe you can answer again.
All right. Oh, so many questions to me. Unfair to other panelists. Okay, Brother Akhwan. Okay, thank you for your questions. Okay, inshallah, we will because this is fall under the territory of RSD. Okay, we will inform RSD to change back. Okay, the operation hours of our kiosk and our cafeteria. And even I think because the MCAN also allowed to extend until 2 p.m. So inshallah, matter will be I will bring this matter to RSD, and hopefully that we can if immediately. Okay, thank you, Brother Ikhwan. Yeah.
Okay, inshallah. You guys can keep the questions coming. We have around 10 minutes left. From Brother Wafi Musa, if MKN allowed any sports activity, does IUM will do the same, such as futsal or basketball, which include physical contact? Dr. Zul, are you there? Oh, okay. Maybe if you can answer the questions, because I think the director of SDC has already answered the questions also in the comment section.
Okay, Dr. Siti want to respond?
All right. Actually, Dr. Mahyudin has answered the question, but to emphasize on that, if we read the recent MKN SOP, sports are allowed except for those with body-to-body contact, meaning that any sports, for example, so the question would be involving the futsal, the basketball, the volleyball, soccer, football, so it's involving body-to-body contact, so it's not allowed. It is in the negative list of the recent MKN SOP.
Okay.
All right. I hope that answer.
Okay, Brother Wafi Musa, I think we will open our swimming pool very soon. So just enjoy the non-physical contacts. And after this, we play soccer, we play football together, inshallah.
Inshallah, Doctor. Okay, next question. Okay, Brother Rafiq Syami, a question for Dr. Masita. Does the COVID situation strain IUM financial means, and what do you think we should do to combat it?
Yes, the answer is to Brother Rafiq. It is hugely impacting the IIUM financial means. But like Dr. Zul said, I think the question goes to Dr. Zul actually. He knows that will be more than many millions being deducted from the ministry to university, not only our university, to other public university. So it's hugely impacting us in terms of management and operation, but as much as possible, as for me in the medical field, and like in Dr. Zul for the student welfare, we are as much as possible try to accommodate the needs. And if we couldn't find the source from inside, as much as possible, we try to get it from outside. But then, as you know, that business outside is not so good, so it's quite difficult. It's very challenging to get help assistance, financial assistance from outside too. So, answer to the question, yes, I am financial strained.
Thank you, Doctor. Next questions from Brother Muhammad Nur Kazim. Is it okay for IM management to defer in regard to SOP with MKN? Maybe Dr. Mashita can answer the question.
We look into the condition that we are having right now, so we have to accommodate to the condition that we are dealing with. Like, for example, if MKN is a general rule, and looking back into our population and our capability, then it has to suit with what is manageable in our side. So as much as possible, we try to accommodate, we try to follow the maximum SOP provided by MKN. But if we think that SOP is not manageable, and then we try to reduce it a bit.
Thank you, Doctor.
All right.
Next questions from Juan Arif. What about for those who have medical appointments at their hometown? Do they allowed to go back home and come back to campus? Dr. Mashita.
All right. For this type of students, what they can do is, if I may suggest that they come to the clinic, we will see how urgent is the appointment is. Sometimes the appointment that they are going to involving the medication we have. If we have the medication, we will provide the medication. If it's not, then we can search for the nearest. For example, if you are having the appointment back in Baling for a certain disease that is manageable in Kuala Lumpur, why you have to go back to your hometown? So might as well we would refer to the nearest hospital for the same management, and we will get the medical data as much as possible, so easier for the next daughter to the nearest government hospital to manage your medical problem.
Thank you, Doctor. From Brother Rafiq Shami. Assalamualaikum warahmatullahi wabarakatuh. My name is Rafiq. I would like to ask if the university will have any plan to open by 2021. Thank you in advance. Maybe Dr. Zul can answer the question.
Okay, Brother Rafiq, for your to all students, for your information, we are now planning for the next semester. So inshallah, next semester will be started on 22nd of February. So we are now planning, preparing, the SOP, but it still depends on the whole situation, of the pandemic. But for your information, we are now, preparing, the SOPs, the guidelines for the student to return to campus. We always want the student to return to campus because we love the student to be on campus, so we can have many activities, we can have face-to-face, we can have many activities with all of you. So inshallah, we will make the announcement soon, but it still depends on the consideration and decision by the Ministry of Higher Education as well. But we want to influence, or we want to appeal to Ministry of Higher Education that we want the student to return to campus. Inshallah. Yeah.
Thank you, Doctor. From Sister Amira Sahudi, is there any possibility for our final exam to be conducted face-to-face? Is there any possibility that...
Okay, to Amira, Amira, for CAED students, if let's say that all students will be on campus, then they can have a face-to-face final exam. But still, the kuliah need to apply to Sejahtera Council, to inform the Sejahtera Council. So right now it's the decision and the initiative by the each kuliah, to do that or not. But as of now, we still continue with the remote teaching and learning. Thank you.
Thank you, Doctor. Next question. Okay, we will wrap up our session for today. Thank you everyone for asking the questions. We hope that we have attended most of the questions and we have make your you know, like we have answered your questions, because we know that pertaining to the SOP that was released, a lot of question has arisen, and we would like, on behalf of the organizer, I would like to extend our utmost and heartfelt gratitude to our guests for the dialogue today. We have been enlightened, and we are glad to be having this kind of direct discussions and dialogue among us students, and also the policymakers and the frontliners of our university. So we would like to again thankfully gratitude for our guests, Dr. Zulkifli Hassan, Dr. Siti Mashita, Brother Amin Nazim, Brother Muhammad Ziaul Haq, for having the session today. And with that, I would like to end our session today with lafaz Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much to everyone.